Welcome to the Global Assessment 2 training module for Moody Health Center at Texas Chiropractic College. I'm Dr. Corey Mayon, the Director of Clinical Education, and I'll be leading your module today. Throughout each clinic course or trimester, students are required to participate in 3 global assessments, G1, G2, and G3. This module will cover G2, or Global 2. Global 2 evaluates a student's performance in their second 5-week rotation. Global 2 is focused on the student's skills. When you sit down to do a Global 2 assessment with each of your interns, you'll access your assessment portal, fill out the assessment intro page, and then assess 4 data collection points, which we'll talk about later. Remember to make notes on any feedback that you've given the intern during your global assessment. An average is taken of the 4 scored components so students can look at it later and see if they scored below, at, or above benchmark for their clinic. Feedback is very important on global assessments as it is oftentimes how students measure their performance and how they know what to focus on their next rotation. Here's a screenshot of the handout you should have on G2. The top covers the individual questions, followed by the meta-competencies tied to each of those questions. Let's go over the questions. Question number 1 talks about their evaluation skills. You're assessing the overall exam and history taking skills of the intern. Next is their skills of passive treatment. This is their skills and overall modalities and manipulation skills. Third is skills in active treatment. You're assessing their overall rehabilitation and active care skills. Lastly is patient management and collaboration. You're assessing their role comprehension and referral utilization. Once you've assessed these 4 components, you'll move to the feedback page. Select G2, type the verbal feedback that you gave to the intern, what went well and things to work on, and assign any clinical education review if required. Type in your 4-letter verification code that only you and the clinic data manager know. Let's see what this looks like. Start a new assessment. Choose your name. Choose the intern you're evaluating. Choose the clinic level they are in. For global, we're going to put G2, or you can type NA, whichever one. For the case type, since we don't have a patient we're treating, you'll select Other and place G2. And we're going to click G2 here and select Next. G2 assessment questions. Skills and evaluation. Student demonstrates appropriate evaluation skills including history taking and examination. You will grade all of these on the Dreyfus model. Passive treatment skills. Student demonstrates appropriate psychomotor skills during passive patient care such as modalities and chiropractic manipulation. Skills, active treatment. Student demonstrates appropriate psychomotor skills during active patient care, such as rehabilitation. Patient management and collaboration. Student explains chiropractic role and the role of other healthcare professionals during collaborative patient management. Notes. Let's say that we discussed with the intern that the area for most improvement needed is rehabilitation. Let's make the active care score relate to that. Finish the assessment. Select Next, brings you to the feedback page. Select Global, what went well? things to work on. If clinical education review is required, you'll fill it in at this point, and then type your verification code. Done. This completes your G2 assessment. You've now completed your Global 2 assessment training module. For any questions, please refer to the handouts, the course syllabi, or the clinic handbook. For questions that can't be found there, refer to the following. For clinical operations, ask the Director of Clinical Services. For educational concerns, you can ask me, the Director of Clinical Education. And for resources, please ask the Clinic Data Manager. Thank you for your attention.